Hello, Amy. This is Penelope, and I just want to comment on your post. I enjoy reading it and about the assessment that you chose. You chose to do a little research on the TWEAK, which stands for tolerance, worry, eye opener, amnesia, and K/C for cutback. And the TWEAK, you said, went on to say that the TWEAK is a 7-question screener tool used to screen for alcohol abuse in pregnant women. Some stats that you started out with, you said that 70% of pregnant women screened for alcohol abuse admitted to problematic drinking. Some of my research found that in the year 2014, a research found that reports that indicated that 11% of pregnant women aged 15 to 44 in the United States report alcohol use. And their drinking in this study was associated to things like intimate partner violence, other substance abuse issues, not receiving prenatal care, things like having a partner who drinks, unemployment, lower educational levels, smoking, and a host of problems. And we know that alcohol use when a woman is pregnant can present other problems, not only for the mother, but for the child that she's carrying. And one of the things that comes to mind is fetal alcohol spectrum disorders, or known as FASD, which is one of the leading causes of physical, intellectual, and behavior disorders and birth defects in the United States. And in 2014, they noted that 24,000 children were diagnosed with FASD, and 1 in 100 children aged 1 to 17 are suspected to have FASD. You went on to note that most often heavy drinking during pregnancy occurs during the early weeks and months of pregnancy when the mother is unaware of gestation. And that's certainly true. A lot of mothers aren't aware that they're pregnant. That's why I think it's a good idea for screening all women, that are of childbearing age, especially when they go to the provider. And I'll talk a little bit about that. I think the TWEAK is a good screener, but there's some places where I felt that it fell short. One study that I was looking at by Wasio and others in 2014, they conducted a study of 225 women receiving care in a Southern California facility, and they said they found the TWEAK alcohol risk and smoking. The TWEAK shows the alcohol risk and smoking and other substance use among low-income women, predominantly women of racial and ethnic minority. They state that the TWEAK could not only be useful for screening for drinking, but it could also be used for screening for cigarette smoking and illicit substance use during pregnancy, which are both a significant risk to the mother and the child, which I noted a few minutes ago. In 2001, Dawson and others added, in their study, they added the question about a mother being a current smoker to the TWEAK, which is not in the TWEAK right now. And they said they found that it increased the sensitivity and specificity for risk during drinking among pregnant women who reported lifetime drinking. In addition, multiple choice questions such as "Do you smoke?" being added to the TWEAK resulted in a 40% disclosure of prenatal smoking, which is something that's not in the TWEAK at the present. Other problems that I found, Amy, you stated that the problems that you found with the TWEAK, you stated that more research needs to be done in various places in order to fully address the cross-cultural validity among different races and cultures. And the study that I was just alluding to said large socioeconomic disparities exist in prenatal alcohol use. And these risks increase due to the increase due to many variants such as homelessness, substance use, and partners that smoke. So, and it also stated that a lot of these women that were found women that applied for different programs like WIC and things like that nature. So, in closing, I'll stay what I feel will be the best venue for the TWEAK to be used for screening for women. I feel like it would be helpful if providers of facilities that provide adjunctive social support services to women and families, such as like WIC, where they apply for WIC and food stamps and Medicaid and Medicare. I think that would be a good place for them to do the TWEAK. especially you have a lot of women that are childbearing age. But the Tweak is an easily administered screener, and it's very effective, as you said, and it's a great way to provide clinical interventions to help reduce risk as a part of prenatal care. Thank you.